Hey everyone, welcome back to the New Way Health channel. Today we're going to talk about Gastroesophageal Reflux Disease, or GERD. GERD is a digestive disease that affects millions of people around the world. It can cause a lot of discomfort and a lot of pain. So today we're going to go over what exactly GERD is, what are the main triggers, what are the most common symptoms, who is at risk for it, how it's diagnosed and treated, and what could happen if it's left untreated. So first and foremost, what is GERD? Well, GERD is a digestive disease where stomach acid, which is very strong, actually starts to eat away at the lining of your esophagus. And this can cause a lot of pain, a lot of discomfort, and even some serious complications down the road if it's left untreated. What are the main triggers of GERD? Well, the main trigger is actually when you eat. So when you eat, your body produces more acid in your stomach to help digest that food. And if the sphincter muscle, which is the muscle that keeps the acid in your stomach, if that muscle becomes weak or it doesn't close properly, then the acid can actually flow back up into your esophagus and cause a burning sensation. Its most common symptom of GERD is, of course, that burning pain in your chest, that heartburn. And that's because the acid is actually burning away at the lining of your esophagus. Other symptoms include difficulty swallowing and even vomiting. Who is at risk for GERD? Well, it's most common in people who are overweight or obese because of the pressure. From the weight on the abdomen puts pressure on the sphincter muscle, which makes it harder for that muscle to close properly. It's also more common in pregnant women and people with diabetes, because of the high levels of sugar in the blood can make the sphincter muscle weaker. How is GERD diagnosed? There's no specific test for GERD. It's usually diagnosed by a doctor based on your symptoms and a physical exam. The main treatment for GERD is making lifestyle changes, such as eating smaller meals more frequently and avoiding trigger foods. So if you know that certain foods trigger your GERD, then avoiding those foods can be helpful. These are usually foods that are high in fat or high in acid. Also, losing weight if you are overweight or obese can help reduce the pressure on your abdomen and help with the symptoms of GERD. If lifestyle changes don't work, then medication may be an option. And there are a few different types of medications that can help reduce the amount of acid your stomach produces or help strengthen the sphincter muscle. What can happen if GERD is left untreated? Well, GERD can lead to some serious complications down the road, such as inflammation of the esophagus, ulcers in the esophagus, and even cancer of the esophagus. So it's important to get treatment for GERD if it's not getting better on its own. Thank you so much for watching. I hope this video was helpful. If it was, please hit the like button and subscribe to the channel. We'd really appreciate it. And if you have any questions, feel free to leave them in the comments below. We'll see you next time.